All right. Have you ever felt this burning sensation in your chest that you don't know what is causing it for a while? So that got you so scared because it's so strange. If that has happened to you, come with me. Let's talk. Or you've been noticing this burning pain in your stomach, and then you're worried that it might get into something that you don't know. That can be very disturbing most times because these regions of the body contain most vital organs of the body. And so when things like this are happening, you are just wondering which of these organs might have been affected. I remember this lady, she kept complaining that she's having this pain in her stomach. It was like hot peppery stuff in it. It was a little bit funny the way she was dramatizing it, and at the same time very serious because only her knows what she was going through. What if I told you that these things can be something they call peptic ulcer disease? The funny thing is that a lot of people might not even be aware until it develops into something serious or more complicated. The good thing is that peptic ulcer, like many other conditions, do present with some early signs and symptoms with which you can tell what you're dealing with. And if you discover this on time and then take the right decision, this will help you to assess quality medical care and then be able to arrest it before it gets out of hand. Although it may not be noticed at the earliest stage of the whole thing, or sometimes it may not just present at a certain sequence or order, but their presence at any moment cannot be ignored without attracting some health consequences. And that's why in today's episode, we are going to be looking at all these signs and symptoms that can be presented early enough for someone to use and seek help. And then we shall look into what you need to do if you notice any or some of these things. Ensure you're still with us. And don't forget, if you haven't subscribed, ensure you do that. So the first thing on this list is burning stomach pain. Okay, a lot of people do present with this. This is just like the most commonest you can notice everywhere. I know many people who usually complain of this. How does it happen? You notice that in between meals, you'll be feeling this pain, or at night, and it goes away just shortly after the meal, or when you take antacid. So people have said that this thing comes in the morning when they've not taken anything. That means it comes in when the stomach is still empty. And so that can tempt some people to say that it's hunger that causes it because they've not eaten, and each time they eat, the thing seems relieved, right? So, but why is it happening like that? You may ask, why is it taking place this way? Why is it paining me in so and so place? A lot of questions will start popping up. But one thing is clear: the stomach contains different gastric acid and enzymes, and this can be very irritating. So let's get this thing straight. These enzymes and acid are usually released in an increased concentration in expectation of food or in response to food intake. So it means at those times of the day when you're supposed to eat, your body has a way of releasing excess amount of food to help in digestion. Or when you must have eaten, you discover that your body releases it in excess amount. So these things are just normal functions of the body. But how does it affect us now? This enzymes and acid has a way of irritating those cells and then causing those burning pains you feel in your tummy. Remember also that there's physical or chemical irritations from the food you eat. Some food particles may just scrape a little part of the ulcer and then you begin to feel some pain, like some spices and peppery stuff. These things can combine to irritate your sores or your ulcers and then cause you a little discomfort. Again, there's this issue of feeling bloated and belching too. Some people say they lose appetite when those things are happening. Yes, it can happen that way because your ulcer might be disturbing digestion and some balance in your stomach. Look at it this way: Helicobacter pylori, which is the chief cause of this peptic ulcer, has a way of altering the balance, the microbial balance in your gastric system. and so accumulating excess gas. So when you have excess gas in your tummy, you're going to feel bloated. Your stomach is going to be full. You've not eaten anything, or you just ate a little bit and you're satiated. That's not ordinary. That's because your tummy is filled up with something else other than food. Inflammatory irritations can also delay bowel emptying, thereby making the gastric system to be filled up. And so instead of you feeling empty, you are feeling occupied with things that its movement is not guaranteed. And so at the end of the day, you are feeling full without food. What is the next thing you may be experiencing? Heartburn. If you are feeling this burning sensation in your chest and you did not take any peptic or stuff like that to cause it, you might likely be dealing with peptic ulcer. Ulcer usually happen in the gastric region, that's the stomach or the duodenum. But sometimes you can notice it at the lower part of the esophagus. And so this is the one that causes what you feel in your chest. How does it do that? When acid from the stomach moves up a little bit towards this lower part of the esophagus, it will irritate those sores, and you feel exact same pain you feel when you have acid reflux disease. So it's almost the same thing. You might be dealing with ulcer and not just acid reflux. You may also feel nauseated and vomiting of blood. This one may sound scary. Okay, how does that happen? Ulcer can cause irritations and scarring of the region between the stomach and the duodenum. And so this thing has a way of obstructing bowel movement, prompting you to throw up. Also, irritations at the site of this ulcer can also make you want to throw up too. And when you finally throw up and you notice some blood, that's because there's already bleeding occurring due to rupture of blood vessels. So you see how these things are connected. Finally, you may also notice that your stool is becoming so dark, almost like charcoal, or you notice trickles of blood around it. It may be due to bleeding along the ulcer parts. We've already mentioned that you can vomit blood, but in this case, it's going the other way around. The sores you have in your GIT can bleed, and when they bleed, they can follow your poo and pass out, coloring your skin in different ways that you may not be able to understand. Although there are other conditions like rectal bleeding or colorectal bleeding can cause all those ones, but it may be a sign that you have ulcer and you need medical help. Now that you know all these things, if you notice any or some of these signs and symptoms, do not assume anything and start self-medication with random drugs and stuff like that. It is important you rush to the clinic so that medical experts will examine you and carry out different assessments in order to know how to help you with the right drugs and guide you on changes in your lifestyle and all those things. The truth is, ulcer can be well treated by experts and you don't have to feel anything again, only if the proper medical procedures are followed. And so, drop your questions and comments so that we can learn together. See you in the next.